Hospice coverage, brought to you by Eligibility, Policy, Innovation, and Community Support. In this presentation, we will provide background information on hospice, the eligibility criteria on how to qualify, institutional hospice, hospice notifications and billing, and finally resources on where you can find more information about this program. Overview and eligibility. Hospice is a 24-hour intermittent program coordinated by a hospice interdisciplinary team for individuals with terminal illness and a prognosis of 6 months or less to live. Hospice allows individuals to choose physical, pastoral, spiritual, psychosocial comfort, and palliative care rather than a cure. Hospice care is initiated by the choice of the client, or in certain circumstances by the family or physician. Hospice care can be withdrawn at any time by the client, family, or hospice agency, and hospice services may be provided in a client's home, an alternate living facility, or in a medical institution such as a hospice care center or a nursing facility. Clients who are active on Apple Health and elect to receive hospice care services through HCA's hospice program are required to have the client's physician certify that they meet program criteria and are appropriate to receive hospice care. Clients must also be eligible for the following scopes of care: alternate benefits plan, categorically needy, medically needy, or alien emergency medical under cancer treatment and kidney dialysis programs only. Covered services. Hospice benefits include services to manage the terminal illness and related conditions, such as services from a hospice-employed physician, nurse practitioner, or other physician as chosen by the client, nursing care, medical equipment and supplies, medications for pain management, a hospice aide, physical and occupational therapy, speech language pathology services, individual, family, or just family grief and loss counseling before and after the patient's death, and short-term inpatient pain control and symptom management and respite care. Hospice staff work with the client, families, and facility staff to establish goals of care and develop a care plan specific to the client. The hospice team provides the client with medical care to relieve pain and other symptoms arising from their life-limiting illness. Counseling is also available for clients to help them cope with their illness, address depression, grief, and anxiety, as well as spiritual issues such as a loss of meaning and a fear of death. Additional services for families and caregivers include counseling services to assist with caregiver stress, anxiety, family conflict, and grief, education to help family members provide hands-on care to clients, proper use of medications, and knowledge of disease progression, religious care, either through the hospice chaplain or community resources, and assistance with the cremation or burial arrangements with a funeral or memorial service. Hospice as a program. When a client is not eligible for regular categorically needy, medically needy, or alternate benefits plan coverage and resides outside of a nursing facility or hospice care center, home and community-based waiver rules are used to determine financial eligibility. This program has a higher resource standard when the client has a spouse, and there may be a cost of care, also known as participation, that the client may need to pay to the provider. Hospice as a program may be used to provide categorically needy coverage for a client at home or residing in a residential facility. See WAC 182-513-1240 and WAC 182-513-1241 1245 for rules used to determine financial eligibility and patient participation for hospice as a program. Clients who have higher income and reside in a nursing facility may benefit from using the institutional rules in WAC 182-513-1317 to determine categorically needy eligibility. If the client's income is higher, medically needy coverage will then be determined and the client may be approved with a spend down amount. A requirement for eligibility under hospice as a program is that the client must attain institutional status as described in WAC 182-513-1320. An individual attains institutional status when they reside continuously in a medical institution for 30 consecutive days or longer, are likely to remain in a medical institution for 30 consecutive days or longer, receive a home and community-based waivered service through DDCS or HCS, receives program of all-inclusive care for elderly, or elects hospice services, or receives state-funded long-term care services for non-citizens. To ensure the correct program is used, the hospice agency must complete and submit the Medicaid Hospice Notification Form, HCA Form 13-746, within 5 working days of the election date. This prevents the nursing facility from getting paid under the wrong program. Applying for hospice. Home and Community Services, a division within the Department of Social and Health Services, determines hospice eligibility for clients. Clients who elect hospice while receiving HCS services such as Community First Choice, Medicaid Personal Care, or a home and community-based waivered service will have their case maintained by HCS financial staff. In a nursing facility, once hospice is elected and the change is completed, the case is then transferred to the long-term care DDCS specialty team. If a discharge to an HCB waivered service is known, Home and Community Services financial staff should keep the case. All other eligibility determinations are made by the long-term care, developmental, disability, and community services specialty team. The specialty unit receives hospice election notices for non-HCS clients. If the client isn't eligible for CN, MN, or ABP medical coverage, eligibility is then determined for hospice as a program using institutional rules. For all other clients on CN, MN, or ABP medical coverage and not receiving HCS or DDCS services, no eligibility determination is needed as they are already eligible for hospice services as part of their benefit package. Hospice services may also be considered for individuals who are eligible for alien emergency medical, cancer, and/or dialysis programs. Hospice providers must get pre-approval from the healthcare authority to bill for the services. Institutional hospice. Eligibility is determined under hospice as a program when a client is residing in a medical institution, such as a skilled nursing facility or hospice care center, regardless of current Medicaid eligibility. If a client is residing in a medical institution, the client may have to pay participation towards their cost of care. When the client is admitted into a skilled nursing facility or a hospice care center, a notice of action is received by HCS or DDCS identifying the individual electing to receive institutional hospice. The hospice agency is also required to report the admission and the change of setting within 5 days to HCS or DDCS. Scenario. Clients who are on MAGI medical programs, the hospice provider must report the admission into a nursing facility to the healthcare authority. Clients on an SSI-related or non-MAGI Apple Health program, and enter a nursing facility or a hospice care center for 30 days or more, a redetermination under institutional rules must be completed. For those on Medicare and Medicaid, the Medicare package covers hospice outside of a nursing facility and hospice care center. For those on Medicare and Medicaid, the Medicare package does not pay for 95% of the nursing facility or hospice care center room and board rate. A redetermination is then done under institutional rules, and the hospice client may be responsible to pay towards the cost of care. Hospice, Medicare, and managed care. Medicare covers 100% of hospice care at home under the Part A medical benefits. Medicare also pays for short-term respite care in a hospice care facility. Individuals approved for hospice and enrolled in managed care plans must see only providers who are in their plan's provider network, unless a prior authorization is made or emergent care is required. For more information, view the Apple Health Managed Care webpage. Hospice, notifications, and billing. The hospice election statement must be filed in the client's hospice medical record within 2 calendar days following the day the hospice care begins. The hospice election statement is completed and must be signed by the individual who wants to receive hospice care or by their appointed representative if the individual is unable to sign themselves. The election statement signifies the individual's choice to elect hospice care and understands its palliative, comfort-focused nature rather than a curative treatment. An elective statement requires all of the following to be included: the name and address of the hospice agency that will provide the care, documentation the client is fully informed and understands hospice care, and the waiver of other Medicaid or Medicare services or both, the effective date of the election, and the signature of the client or the client's authorized representative. The hospice agency must notify the healthcare hospice program manager of the start of care date within 5 working days of the first day of hospice services. This includes clients with third-party or Medicare coverage or both. It also includes all Medicare clients who currently reside in a nursing facility or will be admitted to a nursing facility who have not yet applied or been approved for Medicaid to cover the cost of room and board. In order for Medicaid to begin payment on the election date of hospice, the Medicaid Hospice Form, HCA Form 13-746, must be received within 5 business days. If timely notification is not received, this could delay the payment start date of services, and the hospice agency would be financially responsible for any services provided during the period of non-notification and may not bill the patient for any uncovered days of service. If the client has Medicaid and the hospice agency does not plan to bill Medicaid, the hospice agency is still required to notify the healthcare authority by sending a completed Medicaid hospice notification form for all clients who have elected or revoked hospice services. When the hospice election notice is submitted within 5 working days of enrollment, it helps ensure that the client meets Medicaid criteria on the date of enrollment when claims are submitted for Medicaid payment, the correct Apple Health program is used to make the client eligible for Medicaid coverage, and payments are made to the correct providers for services. Any payments made under the wrong Apple Health program have to be recouped so that the correct payment can be made by the hospice agency. This includes a hospice selection in a nursing facility. The Provider One security team administers and supports access to the Provider One payment system. For more information on how to become a Medicaid provider and related Provider One account information, visit Provider One Billing and Resource Guide. For information on Medicaid billing for fee-for-service medical providers, we've included a link in this presentation. End of hospice coverage. A hospice agency may discharge a client from hospice care when the client is no longer certified for hospice care, no longer appropriate for hospice care, or seeking treatment for terminal illness outside of the plan of care. At the time of the client's discharge, the hospice agency must inform and notify in writing the HCA hospice program manager within 5 working days of the reason for discharge. The hospice agency must notify the healthcare authority of hospice care ending by using the Medicaid hospice form. Hospice coverage ends when the client or an authorized representative revokes the hospice care, the hospice agency discharges the client's physician determines hospice care is no longer appropriate, or the client passes away. A client or authorized representative may choose to stop hospice care at any time by signing a revocation statement. The revocation statement documents the client's choice to stop Medicaid hospice care. You can refer to the Provider Billing and Resource Guide for additional requirements. Resources. For more information on hospice, you can use the links provided in this slide or visit hca.wa.gov. The next 3 slides are Home and Community Services contact information, listed by region and the counties within those regions. This slide includes Region 1 county contacts. This slide includes contact information for Region 2 counties. And this slide includes Region 3 county contacts. Thank you for attending today's webinar on hospice. We would like to provide this opportunity to be able to answer any questions that you may have. You can also reach us by emailing the Eligibility Policy Team at hcaaheligibilitypolicy@hca.wa.gov.